Hello, my name is Dr. Michael Wax and I'm here with Dr. James Sotobeer, and today what we're going to be doing is talking to you fibromyalgia patients, and we're going to tell you some things today that you may or may not have ever heard before, but it's going to completely change your life if you pay attention to what we're saying and you take the opportunity that we're presenting. So what I'm going to do is I'm going to go through some boards that you see behind us, and we're going to go very specifically on exactly what we do in our office and what makes us very, very different from any other healthcare provider you've been to before. So let's get started. So first of all, what makes us different from any other doctor that you've seen is we treat patients metabolically and neurologically. And let me explain what that is. Metabolically and neurologically are two different aspects of why patients have fibromyalgia. And if you don't treat both of them at the same time, you're not going to get better. So let's go into detail about what I mean by neurological and metabolic treatment. So when you come over to our office, we really mean this. No stone is left unturned to determine the exact cause of your health condition. When we talk about metabolic treatments, we are very specific in looking at lab findings. And here are some of the labs that we run. We do a thyroid panel. We do a complete metabolic panel, also known as a CMP. We do a complete lipid panel, and we also do what's called a CBC with an auto differential. We are assessing your thyroid, your adrenal glands, your liver, and several other organs involved in your chronic health condition. All these organs can be affected by chronic health conditions. Not just fibromyalgia, by the way, but many other conditions. By addressing these problems with your thyroid, your adrenal glands, your liver, we basically are taking care of your body. We're helping you heal faster. And I don't want to forget, we also test the gut function, the way your intestinal tract is digesting and processing the foods that you're currently eating. The CMP test, which is back up here, also allows us to check your blood glucose levels. Now this is really key. Blood glucose levels are really important on chronic health conditions, and that's what that test checks for. Now, we get into some other testing called sensitivity testing. And in sensitivity testing, we're actually taking stool samples and we're evaluating for inflammatory processes that are going on inside your intestinal system. We're looking for problems that you may have with milk, eggs, yeast, soy, rye, wheat, barley, all these factors. Many of these fall under the category of gluten sensitivities. If you have a sensitivity to any of these, it could be making your problem worse and you don't even know it's happening. We also want to check out milk, eggs, and yeast, because those are also commonly used products in foods today that are making people sick. So it's very important that we test these. Now, here are some of the symptoms that you'll see with these types of sensitivities. You have chronic pain and fatigue, frequent indigestion, bloating after eating. How many times have you heard that before or said that before? Frequent or loose bowel movements, constipation, mouth ulcers and sores. And some people, a very small fraction, will also talk about that they vomit often. Now, the only way to find out if you're having these sensitivities is to do the testing, and that's what we do here. The next test that we run is called the Adrenal Stress Index Test. That's called an ASI. And that test is basically looking at your adrenal glands, which sit right over top of your kidneys. It's a saliva test. It's a test that we actually use the saliva over the course of about a 24-hour time period. And basically what that test is looking for is how your body reacts to stress. Now, stress affects the body in many ways, but the most important way that we're looking for is cortisol levels. Very important that you have this tested out. Many fibromyalgia patients are affected very negatively about the cortisol that's being released in their system. Now, just so you understand, cortisol can be affected in a positive manner by specific nutritional protocols, and that's what we're going to be doing in here in the office. We also look for autoimmune disorders. Now, if you have an autoimmune disorder, that could be a real catalyst for why your fibromyalgia condition is getting worse over time. Perhaps nobody's looking at this. This is a key factor, and we do the testing in the office. Many patients that have chronic pain or chronic fatigue also test positive for what's called the thyroid antibodies. And those antibodies are called TPO and TPG. And if they're high, you're actually suffering for something called Hashimoto's disease. So oftentimes people are misdiagnosed with a thyroid disorder, and actually it's called Hashimoto's. So they're given the wrong treatment and they don't get better. The only way to find out is to test for this thyroid issue, is to do the testing that we have. Your immune system could literally be attacking your nervous system, and you didn't even know it was happening. But that's why you're getting worse over time. Now, if you suffer from tissue antibodies, further blood work may be needed, something a little bit more specific, and we do that here in the office. We also look for immune panels. These are lymphocytes, Th1 and Th2 cytokine panels, and the natural killer cell activity. That's your body's ability to fight an infection as a foreign invader is coming in. The immune panel actually gives us a very in-depth picture, and without that, you probably aren't getting the best care that you could be getting right now. We also run a test called H. pylori, and that test is, again, testing gut function. Many times people are having a chronic health condition because their intestinal wall lining is failing to protect them against the food particles that are being digested. Now, we also test for intestinal permeability. This is basically where a patient has what's called a leaky gut syndrome. Leaky gut syndrome means that that intestinal wall is not blocking these particles, and it's going through the wall barrier, and it's being attacked by the body. It's basically being looked at the body as a foreign invader. Very important to have this test done. Now what's going to happen is Dr. Soderbeer is going to come in and finish out the presentation and explain to you the rest of what we do.
So the next part of the testing that we're going to do is we're going to go into neurotransmitters, and we're going to test neurotransmitters, and what those are is little chemicals that your brain makes and that they actually use to communicate with the rest of your body. Very important. None of the functions in your body occur without neurotransmitters. We check hormone panels, and that's very important. Hormones such as testosterone in males and progesterone and estrogens in females. If the levels are low and decreased, you can have depression, fatigue, mental fogginess, mood swings, hot flashes, weight gain, decreased stamina. So we check all your hormones. Inflammation is very big. Almost all patients with fibromyalgia have problems with inflammation. What we test, we actually check two labs, homocysteine levels and C-reactive protein. Those are two major tests that we use to look for the inflammation in your body and see what level it's at. Then we go on to glutathione. We check glutathione, which is the mother of all antioxidants. When you think of antioxidants like vitamins A, C, E, glutathione trumps them all. And it's funny, you can't take a pill for glutathione. You can't orally take it. Your body doesn't absorb it that way. So we have some different means that we use, like some skin creams and patches. And glutathione's specifically used for autoimmune diseases. Neurological treatments. This is the second half of the treatments that we go through. The first half is metabolic treatments, which Dr. Wax just went through, and all the testing that we just went through, all the lab work. The second portion of the treatment, the neurological testing, is what we do with your brain and your nervous system, because your brain and your nervous system controls the entire body. So we get into some of the treatments we use are oxygen therapy. Oxygen is a fuel that your brain and nervous system use along with glucose or sugar. Your brain and nervous system need oxygen and sugar. By using the oxygen, we help it heal faster, and we use exercise with oxygen as well, and that'll increase the firing in the brain and strengthen the weak parts of the brain when we're exercising it. Brain-based therapies, we use specific brain-based therapies These are things, again, which exercise your brain. They're different therapies we do to stimulate your brain. Your brain's like a big muscle. And when you stimulate it, it'll become stronger. We use vibration therapy. Vibration fires back to a part of the brain called the cerebellum. The cerebellum controls all your balance and the muscles, the spinal muscles in your back and your legs. Also use auditory, visual, olfactory, which is smell, and caloric stimulation to increase firing in the brain. The caloric stimulation is through the ears. Laser therapy, we have high-tech lasers, Zirconia class 4 lasers that we use. This is a cold laser, so you don't even feel anything, and that helps to heal the tissues. That's been proven time and time again to be very effective. And we also do non-surgical spinal decompression for people that have a lot of low back pain and spinal joint pain. The decompression, what we do is we actually traction out the discs in the tissue in the back, and it sucks water in it and heals the disc, helps it to heal up. Discs become depressed over time because of gravity and weight, and to decompress it makes it healthier. So, once we have run all the tests that we have to run, all the metabolic tests, all the neurological testing, we can successfully treat you with neurological and natural nutritional protocols. Everything's natural. No drugs, no surgery. So you have to ask yourself the following questions. How has your chronic health condition affected your job, your relationships, your finances, family, and other activities? How much does it hurt you? What has it cost you in time, money, happiness, sleep, family time? What is the total cost to you? Where do you picture yourself in the next 3 years? If this is a problem that's not taken care of, where do you picture yourself in 3 years from now? And what is it worth to you if we could improve your condition? What is it worth to you if we could make you feel better than what you are right now? So here's what to do next. If you're really serious about getting this condition under control, and we know you are because you're actually watching this right now, you've taken the time to listen to what me and Dr. Wax have said. It's very important to you. I'm sure you've been every place else and tried every other therapy, and you know that they're not working for you. That's why you've come here, because you're still not fixed. So if you're really serious and you want an alternative treatment, and a treatment that is natural and drug-free, like I've said before, call 770-454-8300. That's our phone number. We're at AtlantaFibromyalgiaDoctor.com, which is our website. I'm Dr. James Soderbeer and Dr. Michael Wax, and we look forward to hearing from you.